Hi, my name is Johnny Ramos and I am going to talk about the procedural volume and outcomes for transcatheter aortic valve replacement. Definition: Aortic stenosis is currently one of the most common valve diseases in developed countries. Its prevalence increases with age and is diagnosed in 40.6% of adults over 75 years of age. It has an insidious course with a long latency period. However, it presents a rapid progression after the onset of symptoms. Without a specific treatment, an average mortality of 50% as 2 years has been described. Surgical aortic valve replacement, or IVR, is the mainstay of treatment for advanced aortic stenosis, improving symptoms and increasing survival. However, there are 30% of patients with symptomatic AD who, due to the risk, are not good surgical candidates.
Aortic stenosis is a heart valve disease that affects as many as 1.5 million Americans. It becomes more common with age, affecting 1 in 10 people over the age of 75. Left untreated, severe aortic stenosis leads to decreased quality of life, heart failure, and even death. Aortic stenosis occurs when the aortic valve, the main outlet for blood being pumped from the heart to the body, becomes abnormally narrowed. In older adults, stenosis is typically caused by wear and tear and the gradual buildup of calcium deposits that stiffen and narrow the valve, keeping it from opening properly. As the valve narrows, the heart has to pump harder to push blood throughout the body, and this can lead to symptoms like fainting or nearly fainting during exertion, chest pain, weakness, and fatigue. While not all aortic stenosis patients experience symptoms, 3 out of 4 older patients with severe aortic stenosis do. However, many dismiss these warning signs as normal aging. This often leads to the underdiagnosis of aortic stenosis. Those that experience aortic stenosis symptoms have diminished quality of life, making everyday activities like climbing stairs and walking increasingly difficult. If you or a loved one has aortic stenosis symptoms, it's important to seek medical attention promptly. Simple tests are used to diagnose aortic stenosis. Aortic stenosis produces a very distinct heart sound, a murmur, and is usually detectable with a stethoscope. But other tests may be necessary. Over time, aortic stenosis strains the heart, causing the heart muscle to become thicker, weaker, and scarred. Without treatment, severe cases lead to heart failure and death. Medications can treat chest pain or other symptoms, but none can reverse aortic stenosis. Only repairing or replacing the defective valve will eliminate aortic stenosis. Without surgery, 50% of patients with severe aortic stenosis don't survive more than 2 years after the onset of symptoms. Aortic stenosis treatment typically requires aortic valve replacement surgery, or AVR. This surgery replaces the defective valve with a mechanical or tissue valve. AVR improves quality of life and increases survival in most patients. But those at high risk for surgical complications may not be good AVR candidates. Fortunately, recent medical advances give new hope for those who cannot tolerate more invasive surgery or are at high operative risk. TAVR, or Transcatheter Aortic Valve Replacement, is a new technique in which a valve is placed by inserting a catheter through an artery in the leg and threading it to the heart. This procedure is minimally invasive and does not require the chest to be opened. There are risks associated with TAVR, including stroke and damage to leg vessels. Aortic valve replacement is still the preferred treatment for most aortic stenosis patients, but TAVR represents a potentially life-saving alternative for those who cannot tolerate more invasive surgery. If you or a loved one has been diagnosed with aortic stenosis or is experiencing symptoms of aortic stenosis, talk with a healthcare professional right away. Get prompt medical attention for fainting or nearly fainting during exertion, chest pain, weakness, and fatigue. And remember, aortic stenosis is a treatable condition, and older age is not a barrier to valve replacement. Brought to you by the Alliance for Aging Research.
Application in medicine. To date, there are two types of percutaneous endoprothesis which have been widely used in different clinical settings. One, expandable ball and sapien valve Edwards. Two, auto-expandable core valve Medtronic. Both are made up of biological material and are implanted inside the stenotic aortic valve. Usually, the implantation is preceded by the dilatation of the native valve with the balloon and later, both the expandable with the balloon and self-expanding one are located and implanted in the corresponding site, using echocardiography and fluoroscopy as a guide.
TAVR is a minimally invasive procedure, stands for Transcatheter Aortic Valve Replacement. Aortic stenosis is a disease of the aortic valve. The aortic valve is like the door of the heart. And when it becomes narrow, patients become symptomatic, meaning they have shortness of breath, chest pressure, sometimes even pass out. So TAVR is a procedure that can replace the traditional open heart surgery. So the procedure starts with numbing both groins. We put lidocaine under the skin, and that prevents the patient from having pain. The patient will be under light sedation, and we will insert catheters. Catheters are plastic tubes that allow us to inject contrast or advanced devices through them into the heart. We will then advance an aortic valve bioprosthesis. Currently, at Tallahassee Memorial Healthcare, we have the two devices that are approved by the FDA to treat aortic stenosis. The Edwards valve is a balloon expandable valve. The valve is mounted on a balloon. So as a stent, you will put it in the position that you prefer and then inflate the balloon. That will expand the valve. Once expanded, the valve is already functioning. The electronic valve is contained within the catheter. The electronic valve is made of a material called nitinol. Nitinol is a material that has memory, so the valve is always wanting to be in the original position. We put it inside of the catheter, and once it's in position, we release it by removing the catheter, the valve deploys itself. By treating aortic stenosis with a TAVR, we are making patients live longer and better. That means no shortness of breath, or chest pain, or passing out while doing their regular activities or even exercise. The evidence has supported that the FDA has approved the therapy for people with intermediate risk for surgery. However, there are at least 2 trials that have shown that this is beneficial also for low-risk patients. So the population that will benefit from this procedure has broadened. The heart team is composed by several people, from cardiologists, invasive and non-invasive, heart surgeons, nurses, anesthesiologists, coordinators. We all are with one mission, which is to provide that patient the best option available.
Pros and cons. Pros. Transcatheter aortic valve replacement can alleviate the signs and symptoms of aortic valve stenosis and improve overall health and quality of life. Transcatheter aortic valve replacement can also reduce the risk of death. Cons. Main vascular complication: ABC, coronary obstruction, myocardial infarction, acute kidney damage, and driving disorders.
Transcatheter aortic valve replacement, or TAVR, is a less invasive catheter-based procedure. It is revolutionizing cardiac care and reducing the need for traditional open-heart surgeries. It's a treatment for aortic valve stenosis. That's when the aortic valve in the heart functions poorly, usually due to calcification, reducing blood flow throughout the body.
We don't take out the valve in the patient. We just move the valve or the stuck leaflets out of the way without having to make a surgical incision at all.
A typical TAVR involves inserting a guide wire into the femoral artery and threading it through the aorta, then around the aortic arch and into the stenotic aortic valve and left ventricle. A common TAVR procedure involves delivering a new valve with a balloon catheter over that guide wire and into the stenotic valve. The balloon is then inflated, opening up the old valve and putting the new valve in place. The wire and catheter are then removed, leaving behind a new, functioning aortic valve. Here you can see the new valve opening and closing and able to restore normal blood flow.
Recovery for those patients, especially those patients that are older, is much faster. Most of our patients stay overnight, and almost everyone goes home within 48 hours.
Cardiologists at UC Davis Health were the first in the Sacramento area to offer TAVR. They continue to lead the way in providing groundbreaking treatment options to patients with heart and vascular disease.
To have the opportunity to provide a minimally invasive procedure for those particular patients who need it is really life-changing for many of them.
Visit health.ucdavis.edu and search for TAVR, T-A-V-R, to learn more about TAVR at UC Davis.
Issue applied in Ecuador. Since 2015, minimally invasive techniques with local anesthesia and percutaneous closure have been used, which reduce hospitalization time and the risk inherent to surgery. This procedure has shown important results in improving the symptoms and quality of life of patients. It cuts mortality in half and has been shown to be as effective as aortic valve replacement surgery.
Now, when we look at the data which has come to make us understand that how this technology has evolved, the first trial which was conducted was called as the Partner 1 trial, which looked at the comparison of transaortic valve replacement in inoperable patients and compared it to the surgical treatment. It was compared to the medical treatment because such patients could not be offered any treatment. And they found that all-cause mortality at the 60 days was significantly better than those patients who were not offered any treatment. So in this trial, in about something like 400 patients, it was found that those patients who were offered this treatment, 93% of them were alive at 2 months, as compared to those who were not offered treatment, only 70% were alive at the end of the 2 months.
Conclusion. TAVI has been developed to treat those patients with symptomatic advanced aortic stenosis who are at high surgical risk for valve replacement. It presents clinical results superior to standard medical treatment, including percutaneous valvotomy. Thank you.